Hello guys, today we'll be talking about histoplasmosis, and we'll be talking about histoplasmosis under the following headings: introduction, causative agents, pathogenesis, epidemiology, risk factors, diagnosis, prevention and control, as well as treatment. What is histoplasmosis? Histoplasmosis is a systemic fungal infection that is caused by Histoplasma capsulatum, a dimorphic fungus that primarily affects the lungs but can disseminate to multiple organs, especially in immunocompromised individuals. Histoplasmosis ranges from asymptomatic or mild self-limiting respiratory illness to severe life-threatening disseminating infection. Histoplasmosis is one of the most common endemic mycoses worldwide, and it constitutes a major public health problem in regions where environmental conditions favor the growth of the organism. Infection typically occurs through inhalation of fungal spores from contaminated soil enriched with bats or bird droppings. It is also important to note that although many exposed individuals remain asymptomatic, clinical disease of histoplasmosis is usually dependent on size of inoculum as well as host immune status and underlying medical conditions. Let's talk about the causative agent. The causative agent of histoplasmosis is Histoplasma capsulatum. Histoplasma capsulatum is the causative agent of histoplasmosis. Histoplasma capsulatum is a thermally dimorphic fungus that belongs to the family Agelomycetaceae. It belongs to the family Agelomycetaceae. Histoplasma capsulatum exists in two distinct forms, and these two distinct forms are dependent on temperature. It exists in the mold form or the micellar form, as well as in the yeast form. In the mold or micellar form, this usually occurs at environmental temperatures of 25 to 30 degrees centigrade. The mold form or the micellar form produces hypha. It produces hypha. This is a hypha. It produces hypha, and this hypha is constituted of microconidia. These are microconidia. These are microconidia. Microconidia, as well as a tuberculated macroconidia. These are the macroconidia, and then there are tubercles on the surface of the macroconidia. So these are tuberculated macroconidia. It is in the mold form or the micellar form that Histoplasma capsulatum exists while in the environment. The yeast form, on the other hand, usually occurs at body temperature of 37 degrees centigrade. The yeast form is the pathogenic form in which Histoplasma capsulatum exists in human tissues. Histoplasma capsulatum is a facultative intracellular pathogen that primarily infects macrophages. It's also very important to note that there are two major varieties of Histoplasma capsulatum. There is the Histoplasma capsulatum, var capsulatum, and there's also the Histoplasma capsulatum var Du Bois. There are two major varieties of Histoplasma capsulatum. There is the Histoplasma capsulatum var capsulatum and the Histoplasma capsulatum var Du Bois. The Histoplasma capsulatum var capsulatum is the most common and wide form of Histoplasma capsulatum. It is the major causative agent, the predominant causative agent of histoplasmosis. On the other hand, Histoplasma capsulatum valdeboisi is the causative agent of African histoplasmosis, and this commonly causes skin and bone lesions. But let's talk about this is basically about the causative agents. Let's talk about the pathogenesis. Let's talk about the pathogenesis of histoplasmosis. Infection of histoplasmosis usually occurs through inhalation of fungal spores into the lungs from contaminated soil that is enriched with bat or bed droppings. These spores are usually converted into yeast forms once in the body temperature of 37 degrees centigrade. Within the lungs, particularly the alveoli of the lungs, the yeast of Histoplasma capsulatum is engulfed and phagocytized by alveolar macrophages. But it is important to note that Histoplasma capsulatum survives and multiplies within the alveolar macrophages, and this is made possible through the presence of certain important virulent factors, including the alpha-1 triglycan as well as the secreted calcium binding protein 1. Mm. Due to the presence of these virulent factors, alpha-1 triglycan as well as secreted calcium binding protein 1, the yeast form, that is Histoplasma capsulatum, is able to survive as well as replicate and multiply within alveolar macrophages. And it does this principally by inhibiting the phagolysosomal acidification process. The infected macrophages, the infected macrophages with Histoplasma capsulatum then disseminates via lymphatic channels and the bloodstream into organs that are rich in the reticular endothelial system. Organs such as the liver, as well as the spleen, lymph nodes, and bone marrow. Within these organs, cell-mediated immunity, particularly T lymphocyte activation and interferon gamma production, plays a pivotal and crucial role in controlling the infection. This is majorly by granuloma formation, which enables containment of the infection. It is important and essential to note that in immunocompetent individuals, these immune processes plays a pivotal role in limiting the disease, but in immunocompromised individuals, unchecked intracellular replication leads to progressive disseminated histoplasmosis, which can be highly fatal if untreated. So this is basically about the pathogenesis, brief pathogenesis of histoplasmosis. Let's talk about epidemiology of histoplasmosis. The epidemiology of histoplasmosis. Histoplasmosis is very common and endemic worldwide, and it is particularly endemic in regions with warm or humid climates and soil that is contaminated with bed or bat droppings. High prevalence regions include the Ohio and Mississippi River Valley in the United States, as well as parts of Central and South America, Sub-Saharan Africa, and Southeast Asia. Occupational and recreational exposure plays a pivotal role in transmission of histoplasmosis. Activities such as farming, mining, as well as spelunking, which is cave exploration, demolition of old buildings, and poultry farming increases the risk of exposure. Histoplasmosis affects individuals of all ages, but severe disease of histoplasmosis is more common in infants, elderly, and immunocompromised individuals. Let's talk about epidemiology, risk factors rather. Let's talk about the risk factor of histoplasmosis. There are certain factors that predispose an individual to either acquiring histoplasmosis or developing severe disease of histoplasmosis. These risk factors include immunosuppression. Immunosuppressive conditions such as HIV/AIDS, organ transplantation, diabetes mellitus, malignancy, and prolonged use of corticosteroid increase the risks of transmission or of acquisition of histoplasmosis. Age is a very important risk factor. Although histoplasmosis affects individuals of all age groups, infants and the elderly people are more predisposed to severe disease. Also, high intensity exposure to contaminated environments is an important risk factor as well. Patients of chronic lung diseases such as emphysema, asthma, chronic obstructive pulmonary disease are highly at risk of acquiring histoplasmosis. Occupational exposure as well, including farmers, miners, cave explorers, spelunkers, laboratory personnel, are highly at risk of developing histoplasmosis. Let's talk about diagnosis. The diagnosis of histoplasmosis is based on clinical evaluation and presentation, epidemiological exposure, as well as laboratory investigation. Direct examination of clinical specimen such as sputum, bronchoalveolar lavage, and bone marrow aspirate under the microscope may reveal small intracellular yeast within macrophages. Culture is an important diagnostic approach. Isolation of Histoplasma capsulatum from clinical specimen is definitive and almost diagnostic, but it takes about 2 to 6 weeks, which is very slow, and it requires strict biosafety precautions. Example of some common laboratory medium that are used to isolate Histoplasma capsulatum include the BHI. The BHI is the brain heart infusion agar. Also, the PDAC, which is the potato dextrose agar with chloramphenicol, as well as the SDA, that is saboro-dextrose agar. These agar are commonly used in isolation of Histoplasma capsulatum. Histopathology is also a very essential diagnostic approach. Tissue biopsy stained with special or histochemical fungal stains such as the Gomori, methanamine, silver, or PAS, periodic acid shift stain, is used to demonstrate yeast forms. Serology is also important, where detection of antibodies against Histoplasma capsulatum antigens using complement fixation or immunodiffusion assays is principally used in subacute infections or chronic infections of histoplasmosis. Molecular techniques such as the polymerase chain reaction offers rapid and specific diagnosis, but it is usually limited by its cost implication. Let's talk about prevention and control. There is no vaccine available against histoplasmosis, and as such, prevention and control relies heavily on reducing exposure and controlling environmental sources. Some prevention and control measures of or against histoplasmosis include avoidance of high-risk environments such as bat-infested caves or areas that are heavily contaminated with bird droppings. The use of personal protective equipment such as respirators and masks when engaging in high-risk occupational activities. Also, proper decontamination and wetting of contaminated soil before excavation and demolition is carried out. Public health education is also very important, especially in endemic regions, to create awareness on prevention, transmission, and control of histoplasmosis. Let's talk about treatment. Let's talk about treatment of histoplasmosis. The treatment of histoplasmosis depends on the severity and the clinical form of the disease. Mild acute pulmonary histoplasmosis is usually self-limiting and it doesn't or may not require antifungal treatment or therapy to treat. On the other hand, moderate to severe acute or chronic pulmonary histoplasmosis is usually treated using oral itraconazole. Oral itraconazole. Oral itraconazole is usually used to treat moderate to severe acute or chronic pulmonary histoplasmosis, and this treatment usually lasts for several weeks to months. Disseminated histoplasmosis, that is severe disseminated histoplasmosis, is usually first treated initially with intravenous amphotericin B. Intravenous amphotericin B. Severe disseminated histoplasmosis is usually initially first treated with intravenous amphotericin B, and then this intravenous amphotericin B is followed by oral itraconazole, which is used for a prolonged period of time. So this is basically about the treatment of histoplasmosis.